I am a third-generation physician and father of a prospective fourth-generation physician. Friday's Child Venture Community is focused on restoring autonomy, purpose, and fulfillment to the practice of medicine and the delivery of healthcare through entrepreneurship and ownership. Also, to reestablish the role of the physician as a pillar of the community and to restore the long-term trusted patient-physician relationship that is critical to providing the best outcomes for patients at the lowest cost. I have over 20 years of investing experience in private equity, venture capital, and real estate. In 2020, I left clinical practice to impact the business of healthcare, and as I have transitioned to venture capital, I have had the opportunity to talk with hundreds of physicians and clinicians who have either left medicine and healthcare or are planning to. One of the common threads currently not well articulated in surveys and articles is that physicians, clinicians, and healthcare workers are leaving because they lack autonomy to manage their careers, schedules, and ability to treat patients in the way that they have been trained to and feel morally and ethically obligated to. This creates unsustainable moral distress. A survey of physicians in 2025 reported 35% of physicians have considered leaving medical practice since the start of this year. More concerning is a survey from October of 23 that reported 61% of U.S. medical and nursing students do not intend to treat patients. Instead, they plan to leverage their medical and nursing degrees towards non-clinical careers such as research, medical devices, pharmaceuticals, and consulting. Friday's Child Venture Community is named after my 3 sons, all born on Fridays. In the Monday's Child nursery rhyme, Friday's Child is loving and giving. The name is meant to evoke a sense of legacy, mission, and commitment to collaborate with the next generation to build sustainable solutions and clinical practices. The venture community will bring together all of the stakeholders, vendors, and resources needed to support independent clinical practices. The intellectual capital will be combined with financial capital to help the doctors and clinicians design, build, launch, and manage practices where they can thrive and their patients can flourish. The venture fund will also invest in startups and existing companies that support independent clinicians and practices. As the number of independent practices increases, the returns of the portfolio will increase. With the support of the Yale Prospect Fellowship, I am confident that we will succeed in raising and deploying over $10 billion in 10 years and positively impact 100,000 doctors and clinicians and 50 million patients. I am an advocate for conscious capitalism and truly human leadership, and the venture community will instill these philosophies in the physicians and clinicians that it mentors and invests in. I strongly believe in the importance of community, mission, and humanity, and agree with David Swenson that the real secret is relationships with the absolute highest quality people. My goal with the community is to leverage mentorship, intellectual and financial capital, and agentic technology to help physicians and clinicians perform at the highest level possible to serve their patients, to create the best outcomes while avoiding unnecessary, wasteful, and potentially harmful healthcare, all while reducing healthcare costs significantly. I appreciate your time. Thank you for your consideration.